Representative Ford in debate.
Thank you, Mr. Chairman. I intend to vote to support this bill, and before you think I'm doing that because I get free insurance by being a legislator, that's incorrect. I don't get it for that reason. I get health insurance because of my service in the military. I'm happy to do that. I was happy to perform the service. I'm glad to have the health coverage. I run a private business from not Tallahassee, and I provide health insurance for my staff. 2/3 of it, so we pay, and I pay all the deductible up front to keep that burden from them. I'll tell you, every year it gets harder. Every year it goes up. Every year I've got to scramble to try to figure out how to pay for it. So it's not that I don't think there's a problem. I do think there's a problem, but I don't think this is a way to fix it. I've heard a lot of figures quoted this morning, but I have my own figures. I'm going to quote you a couple of them. From what I read, 70% of the American public opposes this bill. 38 other states are taking action just like this right now in opposition to this new federal health bill. Our resolution doesn't force anybody to do anything. What it does is extend choice to the ballot box. We're going to let the citizens of Florida tell us what they want. We're not forcing anything on them, unlike the federal government. I intend to support it. Thank you.
All right, thank you, members. Is there any other debate? Representative Bush?
Thank you, Mr. Chairman. Let me just say that I represent a district, probably perhaps the most poorest district in the state of Florida. And I represent pretty much a majority of those people that I represent are uninsured. That's an old saying, the most difficult step of any journey is the first step. And I think that we have, on last evening, took the first step toward making sure that those that are uninsured be covered and assured so that they can go to the various medical facilities, be it clinic, be it their doctors or hospitals, to be treated. I understand what Representative Flakin is trying to do here. I'm against government intrusion. Certainly I'm against government mandates. However, I'm also against people who goes to work every day, people who have families who cannot send their children and their families to the doctor because they don't have any form of health care. If this is unconstitutional, that's why we have 3 branches of government. We have a branch that can give a judicial review or can interpret whether or not this is constitutional or unconstitutional. I think when we have denied individuals who just want the basic necessities of life an opportunity to be treated fairly and to be treated with dignity, I think that we have done it unto the least of these. So having said that, I was to be not supporting the constitutional amendment, and I will be supporting those individuals that I said that I will come here and represent them to the best of my ability, and I plan to do that. And thank you, Mr. Speaker, for this opportunity.
All right, thank you, members. Let me just say in debate that this bill presents an opportunity, and I think right now you can see from the people that are in the audience, the newscasts that have been going on all weekend and overnight last night, there is a lot of angst and a lot of excitement going on in our country right now over the healthcare legislation that passed. The magnitude of what was passed last night and the implications to our constituents is so great that I believe it is in the best interest of my constituents to give them the right to vote on at least this particular liberty of whether or not the federal government can force them to buy a product. It's a constitutional issue that is so great and can be extended to so many other things. We've heard discussions about what this particular legislation could extend to in a negative sense.
Definitely a trend.
But from the federal level, there are things that may be in our best interest overall, or for the general welfare that people are concerned about in terms of whether or not people should drive SUVs or not. Well, if the federal government decides that it's a public interest that we should all drive small cars and dictates that you must buy those cars or pay a penalty, then are our constituents going to want to have a say in that? I think they would. And so I think in this instance, in something so critical as healthcare, that they will want to say whether or not they want the right to choose whether or not they buy a health insurance product and what insurance product it is. By voting for this bill, you are representing all of your constituents, not just some of them. All of your constituents will get the opportunity to vote on this, and that's really what this does. So with that, I will support this and